women, roughly from the age of 45 onwards, is one of the most critical yet often overlooked stages in the life course. It's a time of profound biological transition, driven largely by the perimenopause and menopause, when hormonal shifts can affect almost every system in our body. But far beyond hot flushes and night sweats, this stage is when we can meaningfully influence a woman's long term health trajectory. So, from the age of 45, risks for cardiovascular disease, osteoporosis, type 2 diabetes, and certain cancers gradually increase. These are not inevitable consequences of aging. They are conditions that we can detect early, prevent, and manage with the right support. This is why midlife is such a pivotal window. Lifestyle interventions, screening, weight management, and symptom focused care can dramatically reduce complications later on. At the same time, many women in midlife juggle work, caring responsibilities, and family pressures. Their own health often drops to the bottom of the list. Supporting women at this stage through better education, routine health checks, and accessible menopause care allows them to stay healthy, productive, and empowered during what can be some of the most fulfilling years of life. Investing in midlife health is therefore not just about managing the menopause, it's about protecting a woman's lifelong well being. When we intervene early in the 40s and 50s, we improve health outcomes for decades to come. Midlife is not a decline, it's a chance for prevention, resilience, and redefining well being for the next half of the life. So, I am extremely delighted to have with me today Dr. Bal Sagu, who is the clinical director of Frimley Health, which is our local hospital of obs and gynecology, obstetrics and gynecology. I have Dr. Azmi Birdi, who is a GP and also a women's health clinical lead. I have Melody Chapman, who is our senior medicines optimization lead and pharmacist. I have Sarah Rayfield, a public health consultant from Slough Borough Council. So what we have planned for you today is a presentation initially by Dr. Sagu, followed by my questions to the panel, which I hope you will find interesting. And then we've got time to take your questions. Please do write your questions in the Q&A function, which you should find at the top of the different various icons you see on your bar. I would just request that you do not ask very personalized questions because we are unable to offer medical advice here. So keep your questions general so that we're able to help you. And right through this conversation, you'll also find useful resources from trusted sources in the chat, which our team will be putting in. So with that, I will hand over to you, Bal, to take us through your presentation.
Thank you. Thank you for the introduction, Lalitha. As you said, Bal Sagu, I mainly based at Wrexham Park Hospital, but work across the Frimley Health Foundation Trust, managing the departments of obs and gynae. So hopefully my presentation will come and you can see it now. So we're talking about... Can you hear me and see it?
Yeah,
Perfect.
it's now.
Yes.
Yeah, yes, we can. Yeah.
There is a small lag on my computer. So in terms of menopause, we chose how to live and eat well during menopause, and this is absolutely vital because if anybody knows about the World Menopause Day, which happens every year on the 18th of October, this year it was about supporting women's health globally through midlife and beyond. And that's from 45 years old and plus. And it's about lifestyle medicine in menopause health. So how can we improve our health, nutrition, strength, and wellness during this natural transition in life? So for us to understand what is happening to our bodies, it's very important that we understand what is happening to the hormones, and then as a result we can then manage how to manage the changes that are happening rapidly during a very busy part of our life. And exactly how Lalitha explained, we have a lot going on. You know, not only we're in this midlife whereby we have dependents who are needing you, and then we have dependents that are young and elderly. So you've got the two spectrums, young children and parents, and both are demanding. And then you've got work as well, and you may be at the peak of your work. And to help you manage and balance everything, you need to understand what is happening to your body. So menopause, it's not a phase, and it's a part of life. It's not something that's going to come one day and go away the next day. Menopause has always existed. What hasn't existed is that we've had our life expectancy was originally 50s, and we used to pass away, and nobody ever experienced menopause. The reason why we are seeing it now is because as we are getting older, we are seeing outliving our life, and we are seeing more and more women going off and people living into their 70s, their 80s, their 90s, and now the life expectancy is into the hundreds. And more so, people's retirement ages are going up. So where they used to be 55, 60, and now we're looking at 70s. And what we need to do is be able to manage daily life and living and working with these changes that are going to happen. We cannot avoid it, and it goes. So why do we go through menopause? So despite living longer, the body's whole sole purpose is to reproduce. That is us as a mammal, as animals. Evolution of life means we're here on Earth to reproduce. So we have a function to reproduce. As we get older, that reproductive function declines, and this is why estrogen declines. It disrupts the metabolism. So estrogen is important in terms of bone density, mood regulation, and this goes down as your ovaries stop releasing their eggs. So when we are born, we're born with a finite number of eggs, and these eggs last for about 50 years, and that is your reproductive years. And once those eggs have finished being available, your estrogen goes down, and that's when we start going into the menopause. Now, what we need to do is how do we manage that and going in, and if we make certain lifestyle choices, nutrition, we can help improve these symptoms and improve our quality of life and manage ourselves. But for us to understand, we need to know why estrogen is important. Estrogen regulates the menstrual cycle. So when there is a drop in estrogen, your menstrual cycle becomes disruptive. When there is a drop in estrogen, the vaginal thickness and elasticity reduces, and also the sexual maturity and libido is changed. Also, estrogen is important for bone strength and density. It supports the heart, blood vessel and function, and hence the issue with cardiovascular disease. It also influences skin elasticity and appearance, and it also affects brain function, memory. It influences our mood and our emotional stability, and it impacts sleep quality and patterns. Now, saying that, you will all recognise and probably be familiar with these changes in your body. And the reason why you're having these changes is because the drop in estrogen, because of the drop in eggs. My slides are not moving now. So, common menopause symptoms. So now you'll probably be already understanding what the symptoms are because of the decline in estrogen. So if you understand the symptoms, then you can understand how you can manage those symptoms. Symptoms: hot flushes, night sweats, palpitations, because estrogen is important for your heart. Estrogen is important for your muscles and joints, and hence the pains and discomfort. Headaches and dizziness, because it helps brain function. Tinnitus and ringing in the ears, because the brain is connected to the ears. You get urinary changes, vaginal dryness, because estrogen is important for your vagina and mucosa down below. You get your anxiety, panic attacks, low mood, depression, irritability, crying spells, memory problems, difficulty concentrating, and nervous and tense. And these are emotional, cognitive, because estrogen is important for the brain function, and it becomes unstable. You also struggle with fatigue, low energy, difficulty sleeping, and then loss in your usual activities, reduced in sex, and changes in work performance. But these changes are real and they affect every woman differently. And the reason why they affect individual women differently depends on how their lifestyle is. It depends on their social setup and their surroundings, the people who are dependent upon them, the jobs that they do, and their career progression as well. So if you understand menopause is normal, it's a natural stage of life, you can then find the right support to help you in that stage of your life. And what is important to remember is, because the estrogen is declining over time, what works for you one year may not work for you the next, and you're constantly adjusting and evolving because you're also transitioning through your life in terms of how you are aging, the people who are dependent upon you, and the needs upon your body changes as well. But with proper awareness and management, then you can continue to thrive personally and professionally. So one thing as for menopause, what I suggest is invest in your future health. We all put aside money in our pension, but how many of you actually put aside sort of physical health? How many of you invest in your health? So there's no point having money in the bank, because as you grow older and be able to use your pension, if you are struggling with your body and your physical health, you will not be able to use it and you will not be able to invest it. So investment comes very early. And when I say investment comes early, it's throughout your life, but more so when you are in your 40s, because that's when your decline starts to happen. And if we start making the changes in our 40s, we will note that as we grow older, the demands on our bodies will change, and putting that investment in will help us with our future. Your diet is very important. So I will talk about diet. It's got to be rich in protein, antioxidants, phytoestrogens. And phytoestrogens are plant-based estrogens. So this is naturally containing estrogen found in your in the diet that you can take, and this will help to stabilize some of your estrogen levels. Reducing caffeine, alcohol will help with your hot flushes and with your sleep and your overall well-being as well. It helps your cognition and it helps with your mood because it helps to stabilize. We also talk about weight-bearing exercises, so walking, running, but more important is strength training. So strength training has been shown to improve bone density, and as you grow older, it is about lifting weights and about doing squats, lunges, push-ups and press-ups, because as the estrogen declines, there is an associated rapid decline in muscle mass, and that is a natural part of our body because estrogen does support your muscles. So that's why I talk about movement is medicine during menopause, and it's important that you take this on board and understand that it's part of the treatment that you need. Also, the HRT is important. We all hear about HRT. HRT is important, as is diet and exercise, and it is there to help protect your bones, your heart, and maintain independence and quality of life. So there's many steps that you can take. Just to talk a bit more about diet. So diet is so you can look at dairy products. So milk, yogurt, cheese, they're all rich in vitamin D and vitamin K. They have essential nutrients. They can maintain your bone density and reduce your fracture risk. And fracture risk happens because of the drop in estrogen and the osteoporosis that can happen. And I will talk more about bone density and exercise in the next slide. Whole grains, so switch to brown rice, oats, quinoa. These all provide fiber because estrogen also helps with your intestines and keeps you movement and your bowels going, and this helps that. B vitamins that help with energy, they support lethargy and reduce that as well, and together they support your cardiovascular function. Omega-3s, fatty acids, this is from salmon, mackerel, flax seeds. They all, again, help improve cardiovascular health, and they reduce inflammation. And this can also help ease mood fluctuation. There are studies out there that shows omega-3 is supported and reduces your low moods. Other things that you can have to help boost your bones and improve that is your green vegetables, your kale and your spinach. And if you've got a lactose problem, then milk alternatives. And fish you can have tinned as well, and then almond and sesame seeds, because you've got to remember you have busy lifestyles, you are looking after a range of people, and you need something that is easy to manage and eat and drink to help support you and your life. Strength is nutrition, and it's also movement. So one of the, like I explained, is estrogen causes accelerated muscle loss, and protein is important as you grow older. And what people do not realize is protein is not for that bodybuilder, it's not for that person on the muscle beach, it's actually for women as they grow older. And as you grow older, you actually need more protein than younger adults do. And the suggested is 1 kilogram, 1 gram per kilogram. So a 60 kg person would need about 60 grams plus. And that's the easiest way to think about it. So think about increasing your proteins, your lean meats, your eggs, your legumes, your lentils, and you can also have plant-based proteins for if you don't have the meats or the eggs. And you've got to be very active in looking at your diet, a protein-rich diet, and resistance training, weight-bearing exercise, because together these will help support you as you grow older, and it will invest in your future as well. So in terms of where you can get proteins is chickens, lean meats, fish, seafoods, eggs, dairy products, lentils, chickpeas, beans, Greek yogurt. We all underestimate Greek yogurt has a lot of protein, and that can be combined with nuts and proteins and eaten on its own, or just add it with your meals. Tofu, tempeh, quinoa, and edamame. And if you maintain your muscle mass, you improve your metabolism. So when you are, as you're getting older, you'll say that, oh, my tummy's getting bigger, it's a bit more bloated, or I can't shift this belly weight. And that's because your glucose control goes off a bit. And maintain your muscle mass, increase your protein, helps to maintain that. It provides stability within the levels, and then it also helps support independence in later life. So HRT in managing menopause comes in a variety of forms, and it is tailored to individual needs, and it will be spoken to about in more detail, but there are different types of HRT. HRT is basically replacing the estrogen that you have lost, but it is essential that if you still have a uterus in place, that we give you a progesterone to help protect the lining of the womb, because the estrogen will cause the cells of the lining of the womb to get thicker and thicker each time you take the estrogen, and that can put you at risk of endometrial cancers or hyperplasia. So if you have a progesterone with it, it also means that you maintain that and reduce that risk. It's also important women with endometriosis to take estrogen even if they've had a hysterectomy, because estrogen can reactivate your endometriosis. So there is localized estrogen, so people with vaginal dryness, vaginal discomfort, and problems with the urogenital system, which I will talk about more. There are creams and pessaries which can be used, as well as the systemic HRT, which can come as a gel, a patch, a spray, or a tablet. And also there is testosterone, and we will talk about that in more detail later, but this is mainly for low libido, and that is where the evidence is for the testosterone. You can discuss with your GP or gynecologist about what is the best type of HRT for you. And also there is the prescription prepayment certificate, which helps you be able to afford the HRT as well.
Val, you wanted to give you a little nudge on the time. So
Yeah.
I think, yeah,
So,
thank you.
yes. So, so foods that naturally so libido and sexual health is also a problem. It's a problem because of we are very busy in our lifestyles, and we are very busy with our work, and we have so many dependents that sexual function is the last thing we think about. But there are foods that help you to boost that libido and the sexual health, that you can support and improve that. There's also lifestyle tips to help you enhance your sexual wellness. And we suggest you try this before you go for testosterone. And regular exercise releases endorphins, which helps to improve the blood flow. And then also have a communication, open dialogue with your partner about your changes and your needs, and understand the stresses that you're under from work, family, and dependence. And if you need couples counselling, have it, and it's important that communication is key. Also strengthen your exercise pelvic floor with Kegel exercises, and as I said, meditation and mindfulness is also important. And in terms of vaginal dryness and discomfort, this is a common symptom that happens in menopause. Vaginal dryness is most common symptoms and often happens in up to 50% of women, and there are treatments. You can buy over-the-counter treatments, lubrications. There are then medical treatments, estrogen creams, which you can use with the systemic, and you can speak to your GP or gynecologist to do this. But it is important that you do seek advice, and lots of women do not seek advice. They just suffer in silence. But this is important to help you stay sexually active. But to help with the vaginal discomfort and the dryness, then we suggest, avoid scented soaps, and don't clean down below too much, or you're douching, because it irritates the tissues that become very delicate and reduced from estrogen. Stay hydrated, and this will help you support your overall tissue health. And always remember that vaginal dryness is treatable, and there's lots of medications, and it is important to improve that to help with intimacy. We always talk about what to eat and drink because to support you, but what we forget to tell you is what to avoid, and to avoid foods that can contribute to symptoms of menopause. They can make things worse. So processed foods, added sugars, excessive alcohol, and smoking, they can all impair how our body functions, and they can work against our body trying to support itself and improve for menopause. And caffeine can worsen anxiety and hot flushes, and spicy foods can trigger the hot flushes, and high sodium foods can increase your bloating and your blood pressure. So if you controlled your diet, you would reduce your symptoms of menopause. And what I say to women is, you don't have to completely change your lifestyle now. You make small changes. So you don't have to go tomorrow and just eliminate everything out of your diet. Swap your yogurt for a Greek yogurt 1 week, and then 1 week change your bread to a brown bread or a bread with nuts. 1 week you decide, actually, I'm not going to have sugary biscuits, and change your cereals, and look at the cereals on the back of the packets, because the granolas do have a high sugar content, even though they are sold as a high protein based diet. But when you're looking at your balanced diet for menopause and beyond, you need to eat a rainbow of colours, and you need to make sure that your plate does look with a varied diet, and you can eat a lot of things. But as I say, small changes lead to lasting improvements in strength, mood, and libido. And extreme diets and restrictive eating patterns are not sustainable and not manageable over a long-term period. So it is important to make small changes to make it long-term and sustainable.
Well, we will send the slides, so please do wrap up at
Yes.
this slide. Yeah, thank
So
you.
this is the final. So your menopause wellness journey starts now. You now have the knowledge to take charge of your menopause health. And remember, this is a journey, and you're going on a journey. You're not reaching a destination. You have to be patient with yourselves, and you need to be patient to implement these changes, so you can nourish your body, move your body, and connect, talk to people. Don't suffer in silence, and this will help you thrive and help you start a new chapter of your life. So you can take action by just changing one thing in your diet. Schedule a checkup with your GP and start a simple exercise routine. If it's just 10 minutes of squats, that's all you need to do, and have a conversation with your partner. And final, menopause is not the end. It's a new beginning, because it's a new part of your life. But with the right lifestyle choices and the support, you can live to thrive, function well, and enjoy your life fully. And you have to remember, you are strong. And with your strong body, you can live through decades of life. And with the proper nutrition and exercise, you will continue to become independent and live a successful independent life. Okay.
Well, thank you, Val. Menopause is not the end is a good statement. If you stop sharing, I would like to go to Azmi to ask a few questions. And Anne, I can see your hand. I'll come, if you can just put your question in the chat. I've got some questions for the panel, which I hope you will all find interesting. So Azmi, I know Bal touched on HRT, but what I wanted to ask you was, people do feel tired or have symptoms like hair loss, etc. And HRT is not necessarily the answer to all the problems, isn't it? So could you run us briefly through what a clinician may want to rule out when a woman presents with these kind of symptoms, please?
Yeah, sure. So that's a very, very good question, Lalita. So we have people coming in their 40s sometimes now, because there's so much attention being given to the menopause. So the first thing is that hot flushes and night sweats are not necessarily unique to the menopause. You do get hot flushes and night sweats, around the time of your period, when your estrogen level has dipped very, very low. And then, the women get the period, they get night sweats. Women get night sweats when their estrogen is low because they are breastfeeding, for example. So most women will have experienced some hot flushes, and not hot flushes so much, but night sweats around the time of their period. Now, women who have premenstrual disorder or premenstrual tension or premenstrual symptoms tend to notice these more. And the other thing that happens when you hit 40 plus, 8 and 45 plus certainly, and it depends very much on the individual, your family history, your genetics, and how you follow lifestyle measures, as Bal has explained so well. Weight starts creeping up. Okay, so weight starts creeping up, and that is a natural function of age. Weight does increase, and if you do exactly what you were doing in your 20s and 30s and your 40s, then that doesn't work so well. And a lot of people say they can't lose weight. The other thing that happens is that blood pressure starts rising. People start to feel far more tired because we are juggling multiple things. Women are actually playing more of a caring role than the men are, generally speaking. It's always the woman who focuses more on the child rearing. They're often providing care. So life gets busy and there's tiredness. But a lot of these symptoms can overlap with other things. So for example, thyroid will, low underactive thyroid will make you gain weight, and underactive thyroid will make you tired. So it's very difficult to tease out, what is natural aging, what is menopause, and what is a medical condition. And this is where I think the general practice is so good, because GPs are generalists. They are used to managing uncertainty. They knew how to distinguish various symptoms and perform investigations. And not everyone needs hormones. The other thing is your blood pressure starts rising as fertility goes down. women were, exactly as Bal said, as mammals, and you'll see this across the animal kingdom. Even today, even the Bible alludes to it, that the body of a woman is modified to reproduce, and once the reproductive function is done, there are many species which will die because after that. Now, humans, obviously, we are the most evolved of the mammals, and we are living longer. But along with that, there are other problems that are coming along. So, for example, as your fertility declines, your blood pressure rises. And we see this even in younger women who are going through early menopause. They have a higher risk of vascular problems because their blood pressure is going up. So that's something that is important as well. And high blood pressure can also be linked with things like palpitations. So again, it's the role of the GP to tease these things out. If you go straight to what they call a menopause specialist, then there is only one tool that they keep throwing at you most times. There's a huge general HRT, and there's so much more of that. The other thing is palpitations. Hot flushes and night sweats are often a marker of cardiovascular disease. So they say that women who have the most hot flushes and night sweats tend to have a higher cardiovascular risk than women who don't have them. And even if they're not due to, they may be due to menopause, but they're also markers of heart problems. And everyone is worried about breast cancer and breast cancer risk, but it's heart problems that are top of the list that women need to think about.
And Azmi, what about calcium, vitamin D, and the importance of bone density?
Yes, so women are more prone to having low bone mineral density. Women are more prone to having osteoporosis and fractures, and that's because at various periods of time we have low estrogen levels. So, for example, breastfeeding, childbirth, pregnancy, because the fetus just leaches the calcium and vitamin D from the bones. Most of us are not getting enough vitamin D because we are not exposed to sunlight, and it's direct exposure to sunlight, particularly if you're of a darker complexion or South Asian origin or a person of color. So the important thing is to, as Bal said, to have a balanced diet. If there's a family history of osteoporosis, then your GP may arrange for you to have a bone mineral density scan, or if you've had an early onset fracture. Having a very restrictive diet, particularly the vegan diet, you need to get calcium from elsewhere or supplement the calcium, and certainly supplement vitamin D in the winter months from October to March.
Absolutely. Thank you. And the last thing before I move on is just a reminder that there is still a need for contraception in a woman over 40.
Correct.
Yeah.
And over 45 even 45. Cherie Blair had her 4th child at 47. I always tell people that. And
Yeah, and that pregnancy is possible even for 12 months, even if you don't have a period, isn't it?
Correct.
For those first 12 months. Thank you. So if I could move on to Melody, please. Melody, I know Bal touched on different kinds of HRT. Do you want to just talk a little bit about what is available in terms of HRT?
Yes, I can touch that briefly. Bal covered it really comprehensively, and so a lot of what I'll say you've already heard from Bal. I like to think of HRT in 3 different ways. It's like the types of products that you're going to use. So Bal mentioned these already, but it could be a tablet or a capsule, so something you take orally. It's something that you can apply onto the skin. So there's various products like the patch, the spray, and the gel, for instance. There are also products that can be used vaginally. They've been mentioned by Bal too, and even into the womb. So Mirena coil, for instance. So that I like to think of it in that way. But there's also, we think about the different products, as in the hormones they contain. So it could be the progesterone, it could be the estrogen, it could be progesterone only, estrogen only, it could be a combination of the two. And then I also think about it in terms of, whether you take those products continuously or in a cyclical way. So, for instance, you might take the estrogen all the time, but you might cycle in the progesterones. But I think what women need to sort of be prepared for is come to that consultation with your healthcare professional. And it's a conversation, Lalitha, I would say. It's a conversation around what are your symptoms? What do you want to get out of the HRT? And then you will be asked questions. You'll be asked questions about your family history, your past history. And then together there will be a sort of a conversation. It will be a joint conversation, shared decision on what product is best for you. And do remember, that's the other important thing to remember, that it's only first 3 months that you have to take a product, and then there will be a review by your healthcare professional. If that product is not right, the dose can be changed or the preparation can be changed. So if you don't like the patch, for instance, we could move you on to the spray, for instance, something like that. So it's an individualized approach, and it's not a one size fits all, and it depends where you are on your menopause journey as well.
Thank you. And I suppose the good news for women is that there's plenty of choice.
Yes, lots of choice, yes, as long as there are no supply problems, I think.
Exactly.
But most of those supply problems are now alleviated, and we do have good supplies in the UK now, yeah.
Yeah, and what about testosterone?
Testosterone, yes, well, that's also been covered very well by Bal. So testosterone, as you will have heard from Bal, and you might have read in the health news or seen, on the internet, what does it help with? Most people associate it, I suppose, with increased libido, but it's also muscle strength, bone strength. It's things like, more energy, etc. Everything that Bal has already mentioned, I would say. Now, testosterone, NICE, which is the guidance that all healthcare professionals follow in the NHS in England, does say it's an option, Lalitha, and because of that, it is an option, but I must say it is an option for a small number of women. It's very specific, an indication in the NHS. Also to be aware that the products that are available on the NHS currently, they're licensed for men. They can be safely given to women who have that condition that it's recommended for under NICE. But again, it's that healthcare professional consultation. So speak to your GP if you think it's the right product for you. Come to the consultation, and then the GP, the pharmacist, the nurse practitioner will go through and make sure that everything's optimized, because what Bal mentioned about making sure that other things have been optimized, whether you looked at natural sources of testosterone, that all comes into play, and that really does need to be sort of adjusted for women first before we think about testosterone, I would say, and be prepared as well if testosterone is prescribed for blood tests. That's something you've got to be prepared to undergo.
Thank you so much. Sarah, as a public health consultant, prevention is your goal, and that's what you want to achieve. So if I could just ask you a little bit about screening and health checks, which are commissioned often by public health. Would you touch on that, please?
Yeah, absolutely. Thanks, Lalitha. And as you say, there's a number of NHS screening programs that are available to women in their midlife. And screening programs are really important because they're designed to detect issues early, and oftentimes even before symptoms have appeared. And the reason why that's important is that means usually that would mean that the earlier we detect a problem, then the more effective the treatment is likely to be, and long-term outcomes, and often can reduce complications as well. So there's a number of screening programs that are open to women in their midlife. So there's cervical screening, which is through a smear test, and that's for women aged 25 to 64 who still have a cervix. There's breast screening, which is for women aged 50 to 70, and that's through mammograms, and which sort of takes a picture of the breast tissue to identify any issues. There's bowel cancer screening available to both men and women between 60 and 74, and that's actually done through a home test kit, which checks for blood in the stool. And then as well as those sort of cancer screening programs, we also have the NHS Health Check, which is a program that looks to assess your risk of heart disease, stroke, diabetes and kidney disease. And that's done through a series of questions to look at your lifestyle and also different measurements and tests, including blood pressure, cholesterol, BMI. And there's a recent announcement that we'll move towards including menopause within the NHS Health Check as well. And that will be a number of questions to sort of look at the symptoms that you might be experiencing and then help to direct women towards services and information and treatment options as well. But I think it's just really important to say that, screening's not trying to find problems. It's really about staying ahead of issues. So if you're invited to a test, which you should be for the sort of NHS screening programs, then please do go and take those up. And if you're unsure, there's lots of information through the NHS website online, but also through your GP as well. So it's really about that prevention and protecting your future health as well.
Thank you. Thank you. And I know we talked a lot about holistic health. Is there anything you want to touch on and reinforce about what women can do in midlife to reduce their risk of heart disease?
Yeah, I mean, it's really important, heart disease. It's one of the leading causes of death for women worldwide, but a lot of the risk factors are preventable. And so there's lots we can do in midlife to sort of take charge of your heart health, a lot of which has been covered already. So eating well, and particularly reducing your salt intake, because that helps with your blood pressure, keeping active, but knowing your numbers. So having those blood pressure checks, cholesterol checks. But one of the most important things you can do for your heart is to stop smoking if you are a smoker, and that's one of the major contributors to heart disease. But quitting smoking actually reduces your risk almost immediately, so it's never too late to stop smoking. And again, heart disease often doesn't come with any warning signs in women, so it's really about that prevention piece and making those healthy choices every day.
Thank you. Thank you. Azmi, if I could, and thank you, Azmi and Bal and everybody who's answering questions in the chat to any queries there that are being asked. So, Azmi, there are many women who are now on the weight loss injections.
Correct.
And I just wanted to talk about whether that's okay with HRT, and also anything around myth busting, particularly after 45 in the menopause in general. If you could touch briefly on both of these, please.
So let me talk about the weight loss medications first. The weight loss injection, I think the most common one at the moment that people are able to access and buy online is Mounjaro, which is the injectable preparation. So the thing with the Mounjaro is that it tends to reduce the absorption of any of progestogen that is taken orally. So as Bal explained, there are two hormones if you've not had a hysterectomy. The estrogen, which is essential for helping all your symptoms of menopause, but that thickens the lining of the womb. So to balance that, you need progesterone. And a very common way of doing this is to have a gel and a tablet, the tablet being the progesterone, a patch in a tablet or a spray in a tablet. And it tends to reduce the absorption of the progesterone, not just in HRT, but also in contraception, people who are taking the contraceptive pill containing hormones. So what they've recommended is that the dose needs to be increased. The dose of the progesterone needs to be increased because it may be less effective and protect the lining unreliably. And that increased dose needs to be reviewed every time there is an increase in dose of the weight loss medication. So just be aware, most of the GPs are aware, but just remember that the dose of progesterone may need to be modified. The other thing is the myth busting about the menopause is, one is you touched upon, Lolita, by saying that you can't get pregnant. A lot of people think that they can't get pregnant. The other thing is that even when they can't get pregnant, there are a lot of people in new relationships now around this time. And remember that even if you cannot get pregnant, and you are right in that you cannot get pregnant, you may you may still get a sexually transmitted infection. So if you are in a new relationship, please use protection for prevention of infection. The other myth is that HRT will cure everything. So, people say, am I on the right type of HRT because I'm not losing weight? Somebody else has written in the chat that, somebody has said never to take HRT. A friend is a radiologist because she can cause a cancer. And how is that? So HRT does not cause cancer as such. There was an big study that was done now in 2000, over 20 years ago, and that showed that women who'd had a hysterectomy, they did not need the progesterone. They only took the estrogen. They did not show an increased risk of breast cancer. Women who took both hormones did have an increased risk. The increase in risk, if you take, is small. So I'll give you an example. So if you take 1,000 women and you follow them up over 5 years, this is Cancer Research UK data, and these are 1,000 women, without any particular risk factors, you will get 23 out of those will get a breast cancer. 1 in 7 to 1 in 8 of us will get breast cancer. If we live, that's our lifetime risk. Okay, so that is a 5-year risk. If you gave those 1,000 women HRT, there would be 4 extra cases of breast cancer per 1,000 women over 5 years. So your individual risk is increased by 4 divided by 1,000, 0.004 over 5 years. But if you take it in percentage form, it'll become 25%, 30%, which sounds dramatic. The other thing is that study was done looking at older types of HRT. And after that, people said, okay, so the progesterone is the problem. Let's look at ways in which we can find better progesterones. And they are now what we call body identical progesterones, very similar, almost identical to what your own ovaries would produce. And these are not 100% safe, but in the medium term, for the first 5 years at least, it looks like there's no increased risk of breast cancer.
Thank you. Thank you. So Melody, if I could, I know there's already something in the chat around herbal products, and Azmi has replied to that. But if I could just say, if a woman is now thinking, I actually don't want HRT, let me go and try some herbal products, what would you say to them?
I would say, okay, so some women do benefit from herbal remedies and products. There is a very limited evidence for their use, but in some cases there are small trials that shows that they can be used for the symptoms of menopause. What I would say is, obviously, as already has been said, medicines that are licensed, they've gone through very vigorous sort of trials. Large number of women will have taken the HRT products, and we will know specifically that the dose on the label is the dose that you receive when using that product. We can't guarantee that same level with products, exactly, Lily, exactly. With products bought over the internet and over the counter. So there are some products that have already been mentioned, like I think it was the black cohosh, no, it was the red clover, maybe, and black cohosh, but anyway. So those, you just need to be aware that there's liver toxicity potentially is a problem with those. There is small trials that say they work, and then St. John's wort is one that's particularly sort of marketed again towards menopausal symptoms, those mood symptoms. It can be given actually to men and women outside of the menopause, but St John's wort. And why I want to sort of mention that one really is because that one is known to interact with a lot of prescribed medication. So do speak to a pharmacist, speak to GP, and just make sure that any prescribed medication that you are taking won't interact with that. But you know, they are available, and you know, we do need to be aware obviously also of that fake medicines that you can buy online. So a product that you think you would like to get on prescription, can't get it, but you buy it online. Do be very wary of those, because again, they might not be regulated. There are also different sort of vitamin supplements that can be purchased with the menopause, and I think the main message there is that already being said is about the vitamin D. So if you've got a healthy balance, and I love the Bal's phrase of a, you know, rainbow of colours on the plate, then yeah, you know, probably you don't need those. You can save your money on those, you know, use it for the food. But vitamin D particularly, especially with the weather as it is in these months, we need vitamin D. We all need vitamin D. So do take that. Yeah. I think that's it, Lalitha. I'll pass back to you.
Thank you. Thank
Yeah.
you, Melody. I want to come to Sarah on a really important topic of mental health, because we've been touching a lot on physical health, but we know that regardless of your age or gender, keeping well mentally is really important. So what steps can our audience take to protect their mental health?
No, absolutely, Lalitha. Mental health and well-being is really important, and particularly for women during sort of midlife and beyond. This period of life is a really sort of powerful time for reflection and growth, but also around building that emotional resilience. And as we've touched on earlier, there's lots of different demands on women during this period of time, as in others. And so really kind of taking that time to focus on your own mental well-being is really important. But I think it's particularly important at this time to acknowledge those life transitions and recognize that sort of changes during midlife, such as perimenopause, but also other sort of changes maybe around careers or different changes within families at that time, are really normal and valid, but can come with a range of emotions. And so it's about giving yourself permission to feel those without judgment, but also kind of investing in self-care. So carving out time for activities that recharge you, and that might be simple things like reading, walking, taking some quiet time, or, you know, and having time for particular hobbies that you enjoy, can really help you to sort of achieve that emotional balance. Physical activity we've touched on a number of times already tonight, and it obviously has a huge range of benefits, but particularly can help boost your mood by releasing endorphins, can help reduce anxiety as well, and even just a small amount of exercise can really make a big difference to your mood. But we also know that social connection can be a powerful buffer against depression and loneliness, and there's different ways you can support your own well-being by having those meaningful relationships with friends, family, or even community groups. We know volunteering can help with that, and just sort of embracing those connections across you know, different aspects of your life. And I think sleep is one thing that we've sort of briefly touched on, but really important from a well-being perspective. Having poor sleep can worsen your mood, your memory, but also your tolerance to be able to deal with different stresses as well. And we know that hormonal changes can disrupt your sleep too. So it's really important to try and invest in, you know, a good sleep routine, and limiting screens as well, to just sort of investing in that time. But particularly as well with all of that, you know, that's all around kind of investing in your own sort of well-being and different things you can help to help yourself sort of feeling well. But there comes a point, you know, it's also important that you seek support, you know, when you need it as well for mental health, so not waiting for that crisis. Sort of well-being is possible for everybody.
Thank you, thank you. And I guess we have access to an app called Sleepio. Asmi, you might want to touch on that, but also I wanted to ask you, there are some times when actually even doing everything that Sarah's alluded to, doesn't help, and then you need a bit more help, and that's when you go to the clinician in the practice, isn't it? So perhaps a quick sentence or so on both of those, please.
Yeah. So the Sleepio app is basically a program that's made available free for people in this area. And if you go onto the Frimley ICB website, you will find it. It is CBT for insomnia. And when I've done research through the menopause journals and I've done a literature search, because sleep is a very common problem, not just in the menopause transition, but across genders. CBT for insomnia comes out top. It comes out absolutely top. Sleep is linked with what time you eat. The later you eat, the worse your sleep. If how much television, how much screen time you're having, what you're eating, how much alcohol you're having. It sometimes depends upon, what your sleep pattern has been like before. If it's never been good before, then it's never going to be good after. Sleeping tablets are not necessarily the answer. Now, sometimes people still feel fatigued, they still feel miserable, they still feel, that the HRT that they've been taking is not doing the same thing, and they are watching people on Instagram say their lives are transformed, and they haven't been transformed. You have to, one is that everybody is individual, and that most of the people, the celebrities who are taking HRT are also having chefs prepare their food. They have somebody scheduling their diary. They have fixed hours. They have somebody else sort of organizing their lives. And most of us have to deal with that sort of thing ourselves. So one is do not compare yourself with somebody else. And secondly is, despite HRT, you still have to work at your weight. You still have to work at doing all the other lifestyle things, restrict your alcohol and take exercise and make the time for mindfulness and social connections. You're muted, Lalita.
Yeah, in terms of red flags to go and see the practice.
Okay, so in terms of anybody who's getting chest pain on exercise or shortness of breath on exercise, it may just be age-related.
Also
maybe
for mental health, as me, I just want
yes,
to
and if you're getting really dark thoughts, you feel that you're going to, hurt yourself, you really feel that you're going to, do something, please do not ignore those. That is not part of any normal. You do need to see your GP, and there is help available, but you do have to go and see your doctor for that. Do not ignore that. The other thing that I would just say, Lalita, is that if somebody gets new onset bloating, sort of weight gain around the middle, peculiar symptoms that you can't, again, go and see your doctor, because, people have ignored signs and symptoms of various other conditions that may be an issue at this age.
Irregular bleeding as well, I suppose.
Irregular bleeding is a big red flag. Yes. Yeah, and heavy bleeding, particularly if somebody is getting really heavy bleeding.
Thank you. And I think we've answered almost all the questions in the chat, and I hope that this hour with the panel has given our audience some useful information, some myth busting and strategies. There are plenty of resources and links in the chat, which I'm sure during this conversation you might not have looked at, but all of these are available. Our communications team will make sure that a recording of this and the slides is available to you. And do write of any other topics that you want to hear about. This originated because somebody asked for this topic. So please do feel free to write what you might be interested in. There is a question in the chat saying I'm 45 and sleepy all the time. Does anybody want to pick up that question for the member of audience? Someone who is probably feeling a bit tired, I suppose, when they say sleepy all the time.
Well, I think it's a common problem that people say that they can't sleep at night and they're drifting off, and then yet they'll sleep in front of the television, and that is a problem. The issue is you're not getting the nighttime sleep, the nighttime rest, because there's so much else going on, and it's going on in your mind. And then throughout the day, you're feeling like, you could just drop off to sleep anytime. So I think the Sleepio app would be very, very good for that sort of thing.
Yeah, thank you. And please do write about your future asks in the chat, even as you're signing off, because we look at all of that, and that's how this looking after yourself materialized, because I wanted specifically something for the older woman. So I hope you've all had a good hour and you thought that this was useful use of your good use of your time, I should say. So good evening. Have a rest of a nice day to all of you. Thank you very much.